We're going to access the CPRS icon on the left-hand side of the screen by double-clicking on the notebook. We will then be prompted to enter our access and verify code. And again, the access and verify code that you have been given is the same for each VistA CPRS application that we access. Once I enter the access and verify code, I'll click OK. And the patient selection screen appears. There's several different ways that you can access a particular patient record, either by the listing of patients, entering their last name followed by their first name, or one of the most common ways is to enter a patient name by ward. So I'm going to click on ward, and I'm going to ask for a listing of all the patients that are on a particular ward, 1 East. And here I have a selection screen where I can select any of the patients that have been admitted to Ward 1 East. Before we select one of these patients and move on to the medical record, I'm going to instruct you how to add a patient to the system. I'm going to click on the box, Add a Patient, and then I'm going to enter a patient by the name of William Smith. So I will enter their last name and their date of birth, and filling in these, and click on Add a Patient. And I'm going to use a pseudo social security number. In the VistA system, a patient's social security number is their medical record number. So I'm going to now click on Yes to add this new patient, and the patient has successfully been added to the system. We would now be able to access this particular patient by typing in Smith, William. Right now, I'm going to walk you through the electronic medical record. I'm going to select the patient Thomas Robert Adams. When I click on his name, you can see on the right-hand side, it has the patient's medical record number or social security number, the date of birth, and that they're currently a patient on 1 East. I'm going to click OK. And this brings up the cover sheet of the medical record. And the cover sheet provides an overall synopsis of what's contained within the medical record. You can see the tabs along the bottom are similar to the tabs in a paper record. And we will go into those in more detail as we move through the medical record. But to review the cover sheet, the patient's name is in the upper left-hand corner, and across the toolbar at the top, you can see File, Edit, View, Tools, and Help. As we maneuver through the medical record, as we move from tab to tab, the options that are available in the toolbar under File, Edit, View, and Tools will change and be applicable to that particular tab. If I were to click on the patient's name, Thomas Robert Adams, it would bring up a demographic screen that has information related to the patient's home address, next of kin, when they were admitted to the system, and has the ability to show their insurance information as well. You have the ability to print this out or close it. And moving across the top of the screen, you see the patient is currently admitted to 1 East, who the attending physician is. And over in the far right-hand corner, you can see an area called Postings. Patient postings are progress notes that have been entered into the system that are important to have show up on the cover sheet. And you'll see initials, a C, W, A, and D. A C note is a crisis note, often used and entered if a patient is an elopement risk or if they've had a suicidal attempt, something you want other providers to see right off. A W note is a clinical warning note. These are often used if a patient requires a private room because they have methicillin-resistant staph or some other condition that requires them to be in a private room, or if they're a fall risk, and something to that effect. An A is an allergy note, and it means the patient has active allergies in the system. And a D is an advance directive, that the patient has an advance directive within the system. If I were to click on the patient posting box, it tells me which patient postings this particular patient has. You can see the allergies that are listed here, as well as a crisis note and a clinical warning note. If I were to click on either of those notes, I would see the actual content of those particular notes. I'm going to just click on close now and continue to move through the cover sheet. On the left-hand side, you can see the active problems, and again, I can click on any of these and see the particular details, although there will also be particular details as we move into the Problems tab in the medical record. The same with allergies and adverse drug reactions. If I double-click on any of these entries, I can see the information that's been entered, whether it was a historical, observed, allergy, and I also have the ability right here to add a new allergy, which we'll do right now. So I will click on Add New Allergy. And what comes up is a search lexicon. So this patient, we're going to put down that he is allergic to digoxin. So I will just enter the first 3 letters of the drug digoxin. And you can see here various matches were found. I'm going to match it to the VA allergies file, select this particular entry, and click on OK. And a dialog box comes up related to the allergy that I'm going to be entering. I'm going to enter this as a historical allergy, and you can see if I hover over the word observed or historical, the definition of what those terms mean will come up. So this will be a historical allergy, and it will be an allergy. I'm going to select that. And then the various signs and symptoms. So I'm going to say that this particular patient gets hypotension, chest pain, and hives from this particular medication. I also have the ability to enter a comment in, so I will enter this as a test. And then I also can enter the date and time. If it's a historical allergy, a patient may say, I had the reaction 10 years ago, or they may not know. So I'm going to click on OK. And you can see here the digoxin allergy that I just entered shows up. We've already reviewed the patient postings. Again, I can access these notes from this particular area on the cover sheet. Moving to the middle of the screen, the active medications you can see are listed here. Non-VA means that a medication is something that the VA has not provided to the patient, that they've chosen to get at an outside pharmacy because the copay may be a little bit less, or it's an over-the-counter medication. It's very important that these medications interact with the pharmacy package that we have, so they are entered into the system. You can double click on any of the entries and see when the order was actually entered, the status of the order. You can see this particular order is pending, and it means that it's been entered by a provider but has not been reviewed and released by a particular pharmacist. Clinical reminders are something that have not been populated in this version, but this is a piece of the software that you have the ability to enter that a patient needs a flu shot, a Pneumovax vaccine, Tdap, any of those, and it can be programmed behind the scenes that if a patient's a certain age and has certain problems, that they would require a certain examination, like a diabetic foot exam, diabetic eye exam, things like that, and they would all be listed in this particular area. The lower left-hand corner, recent lab results. If there were some lab results that had been entered, they would appear here as well as within the laboratory tab. Vital signs, the most recent set of vital signs that the patient has had will show up in this particular area. And you can also enter vital signs from this area as well. If I just double click on any of the entries, it will bring up a screen that shows the last entry of these particular vital signs. I'm going to click on Enter Vital Signs. And in this particular screen, enter either any or all of the vital signs that are available. I'll just enter a blood pressure. And I'm going to click on Save and Exit. I'm going to click in the upper right-hand corner, and that's important to note that this is a Windows-based GUI graphical user interface, so anytime you'd like to back out of an option, you can click in the upper right-hand corner. And you can see the blood pressure that I had just entered, is listed here as well. So right now we're going to move away from the cover sheet, and I'm going to just move through the chart and click on the Problems tab. Now the problems also appeared on the cover sheet, but the Problems tab allows you a little bit more detail and the ability to enter a new problem. You can see here active problems for this particular patient are showing. If I wanted to enter a new problem, I'm going to enter the name of the provider, so it will be an analyst. I'm going to tie this to the hospital admission that the patient has been admitted and click on OK. If I wanted to, if the patient was had a problem of arthritis, I'm going to enter the first few letters of the term and click on Search, and it will bring up all the different options that we have available. I'm going to select osteoarthritis for this particular patient, and it will be an active problem, and the immediacy, I'm going to indicate that it's a chronic problem that started in August of 2010. And I'm going to add a comment in here that says right knee. When I'm done entering the information, I'll click on OK. And you can see the entry for osteoarthritis appears at the bottom of the list. You can see when I updated it, which is today's date, and the onset date was August of 2010. Moving along to the next tab is the Medications tab. The Medications tab is divided into 3 different sections. Inpatient medications, which this patient is currently an inpatient, so this area appears at the top. Non-VA medications, which are medications that the patient has chosen to purchase at an outside pharmacy, a commercial pharmacy. And outpatient medications are medications that are provided for a patient from the clinic, and they're provided by the VA. All of the different listings of medications here are checked with the allergy and drug interaction system that's built into the pharmacy package. And that's very important to note, especially if patients are taking some herbal or over-the-counter medications as well that may interact with some of the medications that have been ordered for them. Like on the cover sheet, I can double-click on any of these entries and get the details of this particular order, who it was entered by, whether it's active or pending or discontinued. I will just click the X in the upper right-hand corner. And then we're going to move along to the right and click on the Orders tab. And this is where a provider would go to enter any new orders that they wanted for this particular patient. They're entered into various packages, vital signs, nursing text orders, inpatient medications, laboratory orders, x-ray and radiology orders. And again, at the top along the toolbar, you can see that there's different actions that are applicable to orders available for the provider or the user to access. The user can also look at the default view is active orders, but if a user wanted to see what might have been discontinued or the patient is no longer on, there can be a customizable option for them to view those particular orders. On the left-hand side are the various options available for a provider to write new orders. If I were to click on Add New Orders, a window for what are referred to as order sets come up, and you can see they're divided into different sections and orders. If I wanted to select temperature pulse to have and BP for the patient to have vital signs, the start date would default to now. I'm going to say the patient needs their vitals taken for 7 days. I just clicked on the 3 dots following the stop date, and I'm going to say the schedule for this is 3 times a day. I'm going to accept the order. And it brings me back to the screen, and I'm able to select any other things that I may want to order. When I'm done, I'm just going to click Done. And you can see this is an unsigned order, and it's waiting for this particular provider to review the order and sign it. It will not become an active order until that provider signs that order. Moving along to the Notes tab, which is the next tab to the right. This is a particular area where it's very important. It contains quite a bit of information for providers to use. Notes are available in reverse chronologic order, meaning they're going to appear the most recent one at the top down to the oldest note available. You can see here a crisis note that was entered previously. We're currently in the Progress Note tab, and we're going to enter a new clinical warning progress note. I'm going to click on the option New Note, and then in the Progress Note title, I'm going to type in clinical, and you can see the second option that comes up is a clinical warning note. I'm going to click on that. And then the date and time of the note in this situation defaults to the date and time that the patient was admitted. I'm going to click on the little 3 dots that follow the date, and I'm going to click on Today to make the note title and time default to today, and I'm going to enter a time for that as well. I will then click on OK, and what comes up is a blank screen that I'm able to type that the patient is a fall risk. Now I want to sign the progress note. It should be noted that progress note should always be signed within a short period of time of writing the note, because an unsigned progress note cannot be viewed by anyone else on the medical team. I can go to Action and select Sign Note Now, or I can right-click in the body of the note and select Sign Note Now. I'll enter my electronic signature code. And you can see this particular note has been signed and is available for viewing. If I was another user, or if I wanted to add additional information to the note after I've signed it, I would again go to Action, and I would say to make an addendum to the note. I wanted to indicate the patient fractured a hip in 2011 from a fall. I'm going to say that I want to sign the note now, enter my electronic signature code, and you can see the original note is that the patient is a fall risk, and the addendum that I just entered about him fracturing his hip is attached to this particular note. You'll notice on the left-hand side there was a little plus sign next to the original note, and that indicates that there's an addendum to that particular note. Moving along, the consults tab, consults can be electronically entered by a provider, and they go to a particular service like cardiology, radiology, for a particular test to be done. The provider will then finish the consult with the results of that test, and it will be available. Those results are available either in the consult tab or the progress note tab. Discharge summaries provide information about previous admissions to the hospital, their detailed synopsis. It provides a detailed synopsis of the patient's hospitalization and is really a great area to go to get information if you've never cared for a particular patient. It will provide information about their particular history. I'm going to skip the labs tab for right now. We will go back to that by entering another patient. The reports tab is an area where there's some health summaries that pull information from various parts of the medical record. For example, if we click on the plus sign next to health summary, there are different reports here. I could click on all allergies, and it will bring up information that the patient regarding all of the patient's allergies, what their reaction was to those allergies, and this can also be printed out. Medication reconciliation is another report that's entered in here that will provide a listing of all of the patient's active medications. What I'm going to do now is select a different patient to show you some lab results. I'm going to go to File, and if I wanted to exit out of CPRS altogether, I could select Exit, but I'm going to select a new patient. There's an order that's unsigned. I'm just going to acknowledge that order. It brings up the patient selection screen. I'm going to click on Wards. I'm going to click on Ward 1 East, and I'm going to select the patient Janet Anderson. I will click on OK. It brings up information in the Reports tab. I'm going to click on the Labs tab, and you can see the default for the Labs tab is the most recent lab results that are in there. So you can see on September 25th, this patient had a cholesterol level of 223. It's flagged as high because the normal range is considered 135 to 200. If I wanted to look at a particular test, knowing that this patient had some glucose results in the computer, I would say Selected Tests by Date. I'm going to enter the name of the lab test, which is glucose, and click on Add. So what I'm asking the computer to do is provide me with a list of all the glucose results, and I'm going to indicate to the computer to go back 6 months, and it will bring up the last 6 months of glucose results, starting with the most recent, which was in September 2014, and you can see the results here. And some of the results are high. Any result that has a high, an H with an asterisk, or an L, meaning low with an asterisk, means it's a critical value, and that's all been built into the site parameters of the medical record. If I wanted to exit this particular medical record, I would go to File and select Exit, or I would click the X in the upper right-hand corner of the screen. And that concludes the overview of CPRS.